What if one of the valves in your heart developed in the wrong position before you were even born? That's what happens with a rare congenital heart defect called Ebstein Anomaly. It affects the tricuspid valve, which helps control blood flow between the right atrium and right ventricle. But what exactly goes wrong, and how can it affect the heart? Let's find out. Welcome back to Heart Lifelines. Today, we're taking a closer look at Ebstein Anomaly, a congenital heart defect that affects the structure and function of the tricuspid valve. We'll explain what it is, how it affects blood flow, its symptoms and causes, how doctors diagnose it, and the treatment options available. What is Ebstein Anomaly? To understand Ebstein Anomaly, let's first look at the tricuspid valve. The tricuspid valve sits between the heart's right atrium and right ventricle. Normally, it opens to allow blood to move into the right ventricle and then closes when the ventricle contracts, helping prevent blood from flowing backward. With Ebstein Anomaly, the tricuspid valve doesn't develop normally. The valve is positioned lower than usual inside the right ventricle, and its leaflets may not close properly. As a result, blood can leak backward from the right ventricle into the right atrium. This backward flow is called tricuspid regurgitation. The severity can vary significantly. Some people have mild disease and few or no symptoms, while others can have serious problems beginning in infancy. How does it affect the heart? When the tricuspid valve leaks, some blood moves backward instead of traveling forward toward the lungs. This means the heart may have to work harder to move enough blood through the lungs and body. The right atrium can become enlarged because it's receiving extra blood. The right ventricle can also develop abnormally. Ebstein anomaly is also frequently associated with an atrial septal defect or patent foramen oval. These openings can allow blood to move between the atria. In more severe cases, abnormal blood flow can contribute to low oxygen levels in the body, especially in newborns. That's why the condition can look very different from one person to another. Symptoms depend on how severe the defect is. Some people with mild Ebstein anomaly may have no symptoms for years and may only discover the condition during a medical examination or heart test. Others may experience abnormal heart rhythms or palpitations, shortness of breath, fatigue, low oxygen levels, swelling in the legs or abdomen. And in more severe cases, babies may develop blue or grayish skin, difficulty breathing, poor feeding, or other signs of heart problems soon after birth. Some people may also develop symptoms later in childhood or adulthood. What causes Ebstein anomaly? Ebstein anomaly develops before birth, while the baby's heart is forming. In most cases, the exact cause isn't known. It is considered a congenital heart defect, meaning a person is born with the condition. Researchers have identified some possible genetic and environmental factors, but Ebstein anomaly is relatively rare. It's also important to understand that parents generally do not cause congenital heart defects through something they did or didn't do during pregnancy. The heart develops through an extremely complex process, and sometimes abnormalities occur without a clear explanation. How is it diagnosed? Doctors can use several tests to diagnose Ebstein anomaly. The most important test is usually an echocardiogram, which uses sound waves to create moving images of the heart. An echocardiogram can show the position and structure of the tricuspid valve and how well it's functioning. Doctors may also use an ECG to look at the heart's electrical activity. Other tests, such as a chest X-ray, cardiac MRI, or heart rhythm monitoring, may be used depending on the person's symptoms and condition. Some cases are discovered before birth during a fetal ultrasound. Treatment depends on how severe the condition is. People with mild Ebstein anomaly and few symptoms may simply need regular monitoring by a cardiologist. Medications may be used to manage certain symptoms or complications, such as fluid buildup or abnormal heart rhythms. For people with more severe disease, doctors may recommend surgery. Surgery can sometimes repair or reconstruct the tricuspid valve. In particularly serious cases, other surgical procedures may be considered. The goal is to improve blood flow, reduce valve leakage, and help the heart work more effectively. Ebstein Anomaly is a rare congenital heart defect, but its effects can range from very mild to severe. Understanding the condition helps us recognize how important the heart's valves are, and how even a small difference in heart development can change the way blood flows through the body. Every heart has a unique story, and understanding that story can help us better understand heart health. Thank you for watching Heart Lifelines. We'll see you in the next video.